tDCS Informed Consent video. In this presentation, you will learn about the procedure for experimental tDCS. We will cover what tDCS is, the materials used, what happens in tDCS, and the safety of tDCS. What is tDCS? tDCS stands for transcranial direct current stimulation. This means that we will be delivering an electric current through two small electrodes attached to your head. How much electricity do we use? The tDCS device is powered with a 9-volt battery. We will apply up to 2 milliamps of current to your scalp. This is about the same amount of electricity that is required to power a small flashlight. Only some of the electricity actually reaches your brain. The rest is spread out over your scalp. What are the materials used in tDCS? In the experiment, we will use 2 electrodes that are soaked in salt water. The electrodes are used to apply the electricity, and the salt water helps in conducting the electricity through the hair and skin. A rubber headband. This is a wide rubber band that has holes and clips to adjust the size. It is placed around your head to hold the electrodes in place. The rubber may feel a little tight, so the electrodes do not move, but this should not hurt. In fact, if it does hurt, let the technician know so that it can be adjusted to your comfort. The tDCS device. This is what will be used to make the electric current. Cables. These are attached to both the tDCS device and to the electrodes to complete the electric circuit. Now that you know what tDCS is and all the materials used, we will go over what a basic procedure would look like in an experiment. Where the electrodes are placed depends on the study being conducted. We will find the site of stimulation through some measurements of your scalp. After finding the stimulation site, we will place the rubber headband, mentioned before, to hold the electrodes in place. It will be adjusted and clipped into place. The electrodes are then placed on your head under the rubber band. You may move and mess up your hair a bit to find a good place for the electrodes. Also, since the electrodes are soaked in salt water, your hair may get a little wet, or some salt water may drip down your head and slightly on your clothes. To help prevent this, we'll place a towel around your shoulders. However, if any of the salt water does get on your hair or clothes, please be assured that it will not cause any damages. We then simply turn on the tDCS device, and the electrical stimulation will start. What should I do? Just relax and sit comfortably. You will need to stay seated, but you do not need to keep perfectly still. Also, you should try to stay awake during the experiment. What will tDCS feel like? When the device is first turned on, you may feel a light tingling sensation. In most people, the skin of the scalp gets used to this feeling, and you may stop noticing the tingling after several seconds. However, if your skin is more sensitive, you may continue to feel it throughout the experiment. The tDCS should not hurt. Sensations may vary, and in the past, the feeling of shock has been reported. If for any reason you may begin to feel uncomfortable during the stimulation, please tell the technician. All technicians are familiar with tDCS and should be able to identify the effects. Please let us know of any questions or concerns. Is tDCS safe? tDCS is painless, and initial safety studies have shown that the technique is safe. It has been used in thousands of patients and healthy subjects in many laboratories around the world. Nevertheless, tDCS is investigational. This means that we are testing it to learn more about it. In our labs, we follow all the safety guidelines made by earlier studies of tDCS, including about the electricity and how long the experiments last. Common side effects of tDCS include tingling, itching, or redness at the site of stimulation. Other side effects are rare, but in theory, these other side effects could include altered attention, memory changes, and burns on the site of electrodes. Please let us know if you experience any unusual effects. This concludes the presentation of the procedure of tDCS. We appreciate your feedback on the presentation and on your experience with the experiment. The informed consent has a more detailed explanation, as well as a legal issue concerning the study. Please read it carefully and make sure to ask the technician about any doubts. Thank you for your attention.